Hello, this is Thomas Donald Jacobs for Paperboys on Thursdays, and today's topic is how to deal with things like doctor's appointments and blood work and stuff right now with the pandemic. Um, that's something I was confronted with this past week because this week was the week that I was scheduled to take my Nebido. Nebido is a kind of testosterone that is administered once every 10 to 12 weeks, depending on your dosage, which makes it super convenient. I didn't mind taking the Sustanon. I could administer it myself. I don't have a fear of needles or sticking myself or anything like that. But the fluctuations in my hormone levels, it was not terrific. And the Nebido is really good because you get a very steady level of testosterone. And again, basically once every 3 months. So super, super convenient. The drawback is that you can't give it to yourself. The shot has to be placed about here. I hope you enjoyed the visual. And it's intramuscular, so the needle is extremely long and has to go in super deep. And the shot takes 2 minutes. If you try to depress the plunger any quicker than that, what happens is the Nebido will actually come shooting back out the hole, which is something that happened to me with a doctor who had no experience giving that kind of shot. We were both surprised. But the problem is that you don't get a second go with the Nebido. If you fuck up your shot, that's what you got for 3 months. Sucks to be you. So not the easiest form of testosterone to take in some ways. I called up my GP, and he is not seeing anyone right now. Some doctors are. Others are doing a mix of telephone work and in person for essential medical care. My GP is only doing telephone consultations and referring everything else, which I don't blame him for because he's like a gajillion years old, and I don't want to make him sick. He doesn't want to get sick. I totally understand. So I called up the home nursing service, and because I had the referral from my GP, that means it was on prescription, and I won't have to pay extra for that. My evil socialist Belgian health insurance will pick that up. And it was a little rocky at first because the first nurse that I talked to clearly had no idea what Nebido was or how the shot should be given. So I was really anxious about that because there's no point in having somebody who doesn't know what they're doing give you the shot. There's really not. So I apologized and asked if they could send somebody else. And, that was fine. The nurse was like, look, I don't want to be in a position where I have to guess either. So I am happy to find someone else. Which is something I think people need to remember. Like, if you wind up right now getting referred to somebody that you're not comfortable working with because they don't have any experience, they would probably rather that you worked with somebody who had experience too. So feel free to say so. And the guy that they sent was so good. Showed up, mask and gloves the entire time. We kept our distance, except for when he was giving me the shot. And he had that needle in before I even knew what he was doing. I mean, that's how quick he was. And no pain. It was like, he's actually, that guy better at giving me my injection than my GP, if I'm perfectly honest. I don't even have the usual like second day burning sensation. So that was great. So it all worked out. Um, I know it's probably not going to be that easy for a lot of people, especially if you live in a country which has like next to no healthcare infrastructure like the US. But call in advance if you know that you have something like an injection coming up and see what can be arranged. Um, but definitely do it in advance because you don't know like if you have to get a referral what their schedule is going to be like. So I also would say if you take something like Sustanon or Nebido, and your pharmacy doesn't keep it in stock, mine doesn't. They have to order my Nebido. Maybe go and pick it up a little sooner than what you normally would, just to make sure, in case there's like delivery issues going on. Um, and that was it. Just try your best to plan ahead. Um, be as flexible as you can, but at the same time, remember that it really it is okay to say I'm not comfortable with the referral if you get a referral to someone else. And I will see you next week. Wash your hands. Bye.